Okay, so I get this question a lot about like, how do I do an invisible neck lift incision? I put my air quotes for those that are listening on
Mhm.
podcast. So invisible neck lift incision is typically done with male patients usually not with female patients, but typically with male patients, some younger female patients. And what an invisible neck incision is where you make an incision really hard to see. And so there's basically three spots where I'll put an incision. I'll put an incision underneath their chin. So again, it's not quite invisible, but just I should be barely visible.
Mhm.
And then the second and third incision are behind the ear.
Mhm.
And so what you're doing is some patients, especially men, are really conscious about having a scar in front of their ear, like a
Right,
traditional
right.
facelift. And they're not as worried about lifting this part of their face. So lifting up their face in the lower part, they really just want their neck to be, cleaner. So the way I do that is I put a small incision behind their ear. Oftentimes it's about 2 or 3 centimeters. From that small incision, I'm taking what would traditionally be an incision that would go behind their ear into their neck and all the way in front. So it's taking maybe a 14 centimeter incision and putting it down into 2 or 3 centimeters. And so the benefit of that is, you really have a smaller incision, but everything has an upside and a downside. You might say, why doesn't everyone do that? Well, first of all, it's really hard to work from that small incision and get to your neck
Mm.
and kind of lift things
Mhm.
back. The second reason people don't do it is because you have to deal with the extra skin. And so the way I trim the skin is they'll temporarily will have some pleats behind their ear. So for the first week or two, they might not like the way that looks. But then, knock on whatever, I've never had permanent pleats behind the ear. So essentially, it's what you're doing is removing extra skin through a really small incision, and the benefit of that is essentially no visible scars, or the potential, or should be barely visible scars.
Now, what happens to the fleet? Do they just over time disappear?
So they flatten out. So what happens
Flatten.
is the
Okay.
tissue has been transferred. The extra tissue from here has been moved behind the ear.
Mhm.
And then the pleats look like these slight little mounds back here. And then as the body heals, this stays firm over here, the skin. And as this sort of just kind of flattens out,
Oh, okay.
and your skin's been redistributed. So part of the skin is removed, and part of it is your skin's just been redistributed to another component,
Mhm.
which again, um, whatever reason, from behind the ear doesn't seem to create as much laxity as in the neck.
Oh, interesting.
Necks in general and faces in general, you're trying to get a decade out of it.
Mhm.
And so with this procedure, I think a full face and neck is going to probably give you more longevity because you're literally lifting up the tissues a little more and you're creating more of a sling effect. So I think that a part of it is ideal. However, most patients I think can approach a decade with this. And the benefit of this is you can repeat this procedure again. Typically, they're not having to go here. It just might be a smaller incision here, but they might want to grab through there. So uh, ideally expecting around a decade, and depends on your own skin health and physiologic health. And again, if you're eating Twinkies and Ho-Hos and you're just generally have poor metabolic health and the amount of proteins your body makes and albumin, everything is low, well, your tissues are going to be lax
Right.
because you're just not nutritionally in a good spot.
Mhm.
On the other hand, if you're super fit and you're working out and you're eating everything healthy and you're not having issues with absorption, you're probably going to get more longevity out of your lift. And if it's a properly performed lift, that's obviously super important too. And addressing the deep tissues. If you've addressed the deep tissues once in your lifetime, you typically don't have to address them again. It ends up being kind of managing skin
Mhm.
and managing the surrounding tissues. So to maintain the best result, I think you want to really, first of all, optimize your health. And hopefully this is the springboard. When patients do their face and neck, almost always I'll see them just kind of transform. Even if they're healthy, they seem to be just a little more healthy. And then other things to maintain, I recommend a laser once a year to really get collagen built into your skin.
Mhm.
Because again, we know that the skin just over time, even if you lift it, it's going to loosen elasticity. Being on premium skincare products. So skincare products that are going to be, I think retinol and growth factors are going to be the two things that really help with that. And then if you do need filler, um, usually it's like once a year you get filler just somewhere. So you're sort of maintaining your volume, maintaining everything as you kind of come along. And patients who do that seem to be able to get, much, much longer than a decade, and they can really maintain things with that. So I think fillers are great for maintaining. I don't know if they're okay for reversing. I think surgery is amazing for reversing, great. And then this idea of being able to maintain it with fillers, you create this beautiful synergy between these two processes where you're not trying to overdo things with fillers or overdo things with surgery. You're really just having both of them
Right.
work hand in hand.
And you mentioned skincare and you said a retinol. I think that you have your own line of skincare. Is that right? And you have a retinol?
Yep, that's definitely the retinol I like to have. And I like to have a stronger retinol that goes in there because, again, some of the retinols that are weaker, they don't create a clinical effect. And so I want patients to be able to tolerate the strongest retinol that will not irritate their skin. So retinols that cause irritation can cause a host of other issues. They can cause the nose to swell, can cause redness, they can cause telangiectasias, which are these little blood vessels. But if you have a non-irritating retinol, which I think ours is pretty universally non-irritating, that's super strong. It's super potent. Ours is 1.5%
Wow.
retinol, which is the strongest I think that's on the market. So you can get the clinical effect without the irritation that can cause telangiectasias and swelling and other issues.
I know a lot of my friends who've tried to start a retinol. They've even started with smaller percentages and they've gotten really bad irritation, even some breakouts. What makes your retinol a little bit different?
There's two factors. First of all, it's the delivery mechanism. So if you're delivering it with an oil base versus a water base is just absorbed really fast and it's going to be a rush of retinol to the skin. It's going to cause redness. So oil base is going to have the retinol kind of come over a period of
It's
hours.
like a time release.
And then the other time release is going to be this thing called a microsponge.
Oh, okay.
Microsponges are these little sponges that kind of hold the retinol on the surface. And then over time, they sort of just like release this retinol. So even the retinol you put in the morning, it's still releasing, or the retinol you put at night, it's still releasing hours later.